What was your surgery today? Yeah.
Hi, everybody, and welcome to another Heart to Heart, Less Like More Hearts peer virtual support network group meeting that meets the second Thursday of every month at 6 p.m. Eastern, where we bring health and wellness experts to you in the comfort of your own homes to talk about relevant topics to the amputee community and to the community at large. I am obviously a little down and out today. I just am recovering from a nasal septal surgery 3 days ago, so I may have my video off at parts of today's meeting, but you don't want to listen to me anyway because I have an incredible expert here today. I will cue up his intro to Delcy. If Delcy, you could do an introduction of our wonderful presenter today, Jeremy.
Yeah. Hi guys, Delcy, Oregon here. So I met Jeremy. I was looking for a pain doctor, and Jeremy had just opened a practice near my house called Valor Pain and Wellness. And I spent a lot of time, he spent a lot of time getting to know me because my case is a very detailed, difficult case. And he spent a lot of time getting to know me and asking the right questions. And I wasn't treated like a number. And I just grew respect from there. And so I've started doing all of my pain, nerve injections, sympathetic blocks, ablation, stem cell therapy, ketamine infusions. I do it all through Jeremy now. I trust him wholeheartedly.
Well, it goes without saying that this is a topic that, I mean, everybody is interested in. I had folks, I was just introducing Denise, who we met on LinkedIn literally 20 minutes ago, and she's like, I have to come. So I know that this is going to be really reviewed. And just to give you guys a little bit of background before Jeremy educates us, you can find his business and information about him at Valor Pain and Wellness.com. He is a CRNA, so a certified registered nurse, I believe anesthesiologist or anesthetist, right, Jeremy? And an NSPM-C, which I'm assuming is a pain management certification,
That's
national.
correct.
Okay. And
That's
he
correct.
board certified in non-surgical pain management. He has a fellowship where he trained in pain management specialty, and he's just an amazing guy that also graduated from, for folks that follow colleges, University of Alabama at Birmingham, and he began working in the trauma and burn ICU, and also was a flight in a flight nursing program.
Roll Tide, baby, roll Tide.
So
Yeah.
I'll let him share anything further, but really the big point I also want to bring up is for our veterans that follow, he is also a veteran. He deployed to Afghanistan in the Army Reserves, I believe. And
Yep.
Since he left there, he was further educated about pain and has now pursued this passion to treat people that have been sidelined by acute and chronic pain and get them back and functioning at a higher level, which, as you just heard with the testimony from Delcy, is something that's happening for many of us that have the pleasure of being cared for you or by you, Jeremy. So really excited to get this information out about stem cell therapy because a lot of people don't know about it. And I'm really happy to know of a vetted resource that if folks are interested and are meeting hard blocks, now they know who they can go to and trust.
Yeah. All right. Am I on?
You're on.
All right. Great. So we're actually here at Starbucks. So usually I would be in my office somewhere a little quieter, but I'm in transition. I got to go to a dinner meeting later on tonight. So I was like, I got to stop by Starbucks to get my fix, but also we'll just proceed from here. So if y'all can tolerate a little background noise, I would appreciate it. So yes, my name is Jeremy Newton. I've been doing anesthesia for probably 22 years now, as my background. Once I graduated anesthesia school, I did go to UAB in Birmingham. I was born in Alabama, so I hear you, Roll Tide out there. But you can be very disappointed that I'm actually a Longhorn fan. I appreciate both, but like I said, Alabama's got a great football team. So now see your horns down. Looking forward to the playoffs for sure. But I really want to thank you guys for
I'm
having
from
me.
Connecticut, so I was just being supportive.
Oh well, hey, like I say, well, football is football, so it's all good.
I love watching it. So
It's good. Like I said, any team that's a good Saturday football team, I'm good to watch. So, So yeah, so my background is anesthesia. I recently opened a practice in Prosper, Texas. Again, doing anesthesia for 20 something years. I did serve in the Army Reserves. I was deployed to Afghanistan in 2003. Was in there for about a year. Went to Germany for about a year. But during that time was probably a pivotal time in my career. Newly graduated from anesthesia, but the exposure to, a different type of trauma. I mean, you're around trauma a bunch, but this was a different type of trauma that wasn't just pain. There were a bunch of amputees and things just from landmines and all the other PTSD, traumatic brain injury, and then just the chronic things that go on, after you serve. A lot of people that I served with, I've kept in contact with them. And you hear the stories from them. I mean, they're the struggles that they go through, and a lot of times, I can, just from my perspective and the patients that I've taken care of or have been around, they're, when you're in the hospital or maybe, newly have had your, maybe a limb amputated or whatever traumatic event happened, there seems to be a lot of family support early on. And then sometimes, weeks down, months, years later, I wouldn't say you lose support, but you may not find that initial support that you had, or things change. So, that's one thing is kind of just, I want to be there for my patients, even the buddies that I served with. But it's an ongoing process. So Delcy walked through my doors several months ago, and she's a fascinating lady. Again, I won't get into all the details, for HIPAA and all that sort of things, but she walked through my doors and really someone that I connected with really quick. A complicated history, a complicated, traumatic event that, it's not just one thing, as you guys probably realize. It may just be one issue, but again, a lot of times there's other things involved that you're dealing with. Now it's emotional. Now it's, some other things that have, maybe have taken course. So, with Delcy, just really opened my eyes again, reminded me a bunch of the days that I served in Afghanistan and just, what she's been through, what she deals with on a daily basis. And so with her care, like I would do with any of my patients, but I really want to know who they are, what their experiences have been, and then what do they want out of the treatment. Um, People that have chronic pain or traumatic events in their life, um, they probably have been to a lot of providers. They've gotten different opinions, maybe good experiences and maybe bad experiences. But I wanted to be a provider that really listened, put out all the information, all the research that I have or knowledge that I have, and my knowledge is limited. So many conversations Dustin and I had were, you know, I'm not sure about that. Let me do some research, or can we try this, or just kind of explore in a safe manner. And many times we did that. We, communicated and tried some things, but making sure that she was a part of that. So what I have learned through anesthesia, I mean, my background is to treat pain. I mean, that's what I do. For surgery, we want to make sure that you're not hurting, that you're asleep, and that you wake up, right? That's important. But what is your initial recovery, your pain status? So in the operating room or in the hospital setting, most anesthesia providers, we're trying to get you through pain for, maybe 72 hours. But beyond that, you go home, you have ongoing pain or new situations that arise. So that's where my heart has been, to kind of help the more chronic ongoing pain. And what are the things out there that you can do to help treat certain types of pain and conditions and things like that? Yeah. You have a
May
question?
may I ask a question?
Sure.
So I am currently Okay, so my accident was 7 years ago. I had my amputation a little over a year ago because I
Mhm.
had a salvaged limb,
Mhm.
which is common. I'm learning. I just went to ski spec in Colorado last week, and it's a ton of amputee skiers and snowboarders from all over the country.
Mhm.
And basically they have like prosthetists and clinicians and all this stuff there so that you can snowboard or ski or whatever. Well, the first 2 days I was like feeling like crap. I had altitude sickness. My O2 was at 60 to 6. I um ended up not remembering the next 3 days. I came home. I'm in the hospital now. But besides that, my question to you is, how does the protocol differ? So I do ketamine here in Connecticut um, for depression, but I would like to do it for pain management because I feel like it's starting to work for my nerve pain, but I don't think it's enough.
Mhm.
And I feel like it could really benefit me if it were the pain protocol. So how does that differ from what I'm doing with, I'm sorry, my hands are really shaking really bad.
You're fine.
I keep like dropping the phone. How does the pain protocol differ from the mental health protocol? It,
There's a whole gambit of protocols and really just providers and what their comfort level is or what their protocol is for, ketamine, whether you're treating depression or chronic pain or phantom pain, whatever it may or may not be. Um, I work, I've worked in actually two different ketamine clinics in my history. Some clinics, most of them, you're trying to group at least six treatments together. And what you're trying to do is build a therapeutic level of ketamine that you can have an infusion. The goal is to get you months, right, without having
yeah.
ketamine. So you do several in a row, you increase your dose until we can get you out far enough to where maybe you only have to come back, every few months, or you may get a whole year and your
Wow.
pain is under control. But a lot of that depends on
So
therapeutic.
I'm at 4 doses.
Yeah, and it depends on what your strength is. Do you know how much ketamine you get?
So we do the nose sprays and I'm at
Okay,
4.
okay. So typically I do the IV. You can do, there's several different routes. I
I feel
found
like the
better
IV
that
would be more productive.
again, that's gonna be a personal preference.
Yeah.
Your provider, I always feel like I can control and increase better, more therapeutically doing an IV and get,
Okay.
I wouldn't say better results, but results that, can be gauged pretty quickly. And
Okay.
then you can increase the dose from there. So again, it's finding a provider that they're comfortable doing that. Now there is a national shortage. I think they're starting to open up a little bit and have some vials available, but there is a national shortage of ketamine at the moment. So it's very scarce.
Wow.
But some people they got plenty on hand, but they should be opening up the availability within the next, hopefully month or so. They said by
Okay.
first quarter of 2024.
Jess,
Now do
I put the information for his business in the chat, and
oh,
I'm really glad you brought this information up. I know we're focused on stem cells today, but
I'm
I'm
sorry.
glad.
I
No,
didn't
no,
realize that.
I'm so
Oh, you're
glad
fine.
that you asked the question, and I'm so glad you're here to have had him to even answer the question. It's really important, and you've gone through a lot. So I never want you to hold questions. So
Okay.
I'll make sure the two of you can connect and that we can,
Yep.
get a chance to
Yeah,
work for something moving forward. And
absolutely.
and if you can't find his contact info, just shoot me a DM and we'll make sure that that happens because it's so personalized. I'm sure it
So
will take
much.
more
And
time.
what did you say? I'm like I'm like forgetful because I'm off the oxygen right
I'm
now,
gonna
but
I'm gonna put
what
the information for him in the chat and I'll send you a personal text message, Jess, okay?
Yeah.
what was it? What was this supposed to be about though?
stem cell therapy for the treatment of pain, but
Oh, okay,
anything
that's
related.
amazing too. I would love to do that with my knee because I tore all the CLs, ACL, PCL, MCL, meniscus, all the
Nope,
things. And
Yeah,
you're in
so
the
I
right
Jeremy,
feel
place.
like then
just to let
that
you
would
know,
be great for
Jess,
the knee.
because I've experienced both. The ketamine did a lot for me from a PTSD, trauma, depression perspective. It limited pain just slightly, but the stem cell infusion was a game changer when it came to pain. When it came to my traumatic brain injury, my phantom limb pain, all of the chronic pain that I deal with on a daily basis. So I think that's what Jeremy will start talking about.
Yeah, and like I said, I will, if you guys want to talk about anything else under the sun, I'm totally good with. I have a few slides on the stem cells. You guys can look through those. Obviously, this is recorded, so you guys can go back through those. It's kind of a surface level because you can get really, really deep into, stem cell, like down to micro, and it's boring. But I'm sure you guys just have information or questions about, how does it work? How can it work for me? What's the protocols and things like that. But if there's any information that I don't tell you or you want more information about, please contact me. You can email me or text, call the office, and I would be glad one-on-one situation to go into more detail for your specific condition. So
Jeremy,
if
I
I
just
run through
made
the
you a
slide,
co-host too, so that you're able to share screen if you have that up.
yeah, yeah. So
I
I'm
just
going to
made you
share
one.
that, and then you guys will open up for questions. It's a short little, I think I got 10 slides is what I got on there. So it's not much, but we'll just go into kind of what stem cells are, um, how you get them, what conditions they treat. And just so you know, stem cells, I don't know, everybody comes from a whole different variety of what they know about stem cells. Some people never even heard the word. There's other people that have done a whole bunch of research, but in the end, the research is still ongoing. There is so much that has happened, daily on stem cells. There's not a ton of studies in some of the areas, so you may not be able to find exactly what you're looking for, or does it work for this or that. But overall, it's very helpful. I have not treated a patient that hasn't benefited in some form. And like I said, the downside is it's very natural. So, when we start talking about taking pain meds and other medications, I'm not saying you shouldn't take those or you shouldn't, continue regimens that you're already, a part of. But this is a potential different avenue that's more natural that may do things and actually heal your body that some medications are really more or less band-aids, if you will. So, okay. So I'm going to share this screen. If you have a problem, you can yell at me. Give me just a second to get it up on
Can I say
here.
two things while you're bringing that up? Just because
Yeah.
I'm so excited. So the stem cell therapy got rid of my phantom pain. Zero, gone. Now I fell in September and it came back. But until I fell, zero, completely
Wow.
gone. And I had tried everything. And then I just got back from the neurologist last week and I had a traumatic brain injury in my accident. I had damage to the frontal and parietal lobe. There is no evidence whatsoever on an MRI, on an EEG, on a test of me ever having a traumatic brain injury.
Amazing. Do you attribute that
Yeah.
to the stem cells, Jeremy?
So there again, and we've talked about this, the physician's like, well, it could be, it couldn't be. It's no one's going to come out and say
Right.
that's the golden ticket right there,
I
you
think so.
know? But again, she's had stem cells. We know through evidence and just talking to her, she's had changes that she can tell, right? So can you contribute that to be 100%? Well, I mean, there's a lot going on, but there is evidence and studies that it can help with traumatic brain injury, depression, other neural type of cells, not just neurons, but we'll get into the presentation, but like cartilage and bone and other types. So Yes, very, very possible that that's a contributor. Okay, so I'm gonna share my screen here really quick here. Okay, can y'all see that?
Yes.
Okay, so slide number one. So what are stem cells and regenerative medicine? So I know, like I said earlier, you guys, has anybody not heard the term stem cells or regenerative medicine?
Can you maximize your screen, your view screen?
Maximize, yeah, I am listening. Yeah.
Oh, maybe slideshow?
Maybe.
Oh, you
Is
can.
that better?
Yep, perfect. And it's
Okay.
moving now too. It's great.
So don't you like that? Yeah,
Nice.
that's false. Um, yeah, my kids know how to do that way better than I can. So I can hear, has anybody not heard of stem cells or regenerative medicine or anything like that?
I think everyone's probably heard the words, but probably are either
Okay.
underinformed or misinformed about all
Okay.
the details.
So basically, we talk stem cells and regenerative medicine. Everybody has stem cells in their body. So when you are born, I think the data out there shows that as a toddler or a young child, one in every 10,000 cells in your body is a stem cell. When you're an adult, that dilutes down to like one in 350,000. Okay. So if you look at that, if you know anything about young kids, they're energetic, they're all over the place, they heal faster. Many reasons is because they have stem cells. Their immune systems are strong. Obviously, there's exceptions to, child, syndromes and diseases and things like that. But for the most part, stem cells, one in 10,000 is very potent. So as we get older, our stem cells are 1 in 350,000. So we're more apt to, maybe not heal as quick or not as energetic and more susceptible to things that we are exposed to in the environment. So whether that's you know viruses, diseases, cancers, and things like that, your chances seem to increase as you get older, only because your stem cells are a little more diluted. Okay. So basically, what stem cells do, let me go to the next slide. So mesenchymal cells is another name for stem cells, okay? So you guys can read as well, but what we do are mesenchymal stem cells. They're adult, they're very potent, specialized cells that are capable of renewing other cells through cell division. So your cells divide and they can differentiate, become different types of cells, such as osteocytes, which is bone, adipose, you'll find that in your fat tissue. Chondrocytes is cartilage, so you'll find cartilage in your knees. Most joints have some form of cartilage. You'll see the ectodermal, so neurocytes. And that's a lot that you guys deal with phantom pain, maybe the TBIs, the depression, all those things have to do with your neurons, okay, how they fire and transmit information. So again, whether you've got shoulder injuries from, playing sports or repetitive motions or things like that, stem cells can actually, if you're infused, so you can give stem cells several different ways. I'll show those in the next slide. But you can either infuse them through the body, which is more of a systemic type of circulation that can hit several different areas within the body. So that's where, in the brain, maybe you have what we call autonomic, like autoimmune type diseases, diabetes, thyroid disease, um, Crohn's disease, lupus, fibromyalgia, those types of syndromes can respond, rheumatoid arthritis can respond very well to an infusion of stem cells because it goes through the circulation and just kind of pinpoints, it locates and identifies cells that are not healthy. Okay. And then the other route is being able to inject stem cells into a joint that may be damaged. So maybe cartilage damage, like you mentioned your knee. Jesse, of just hurting damaged cartilage, tendons, and things like that. Okay. So as we talked about, where do we find these stem cells? So in your body, you have your own stem cells, okay? So in your bone marrow, so bone marrow is typically found, like if you take your femur or your tibia, those long bone, we call those long bones. So inside the shaft of those long bones is where you will find stem cells. You can also find them in your hips. So usually in the back, you can feel your hip bone, even on the side. You have pretty good stem cells in those areas. You can get it from adipose tissue, which is your fat tissue, amniotic fluid. So anybody familiar with birth, you have the amniotic sac, you have the placenta, there's stem cells in there, endometrium, that's female parts, dental tissue, the umbilical cord, and Wharton's jelly. Okay. So those being maybe some words you guys aren't familiar with, but within your own body, you can go in and aspirate and take stem cells from your own body. Okay. So that's getting a little needle, or we call it trocar, getting down inside the bone into the area where the bone marrow is. Okay. A lot of people don't like that idea of, you know, penetrating and getting, bone marrow from your own person. So what I have been doing for quite a while now is getting stem cells from umbilical cord. Okay. So basically what you're doing, how that happens is a company, a laboratory where I get the stem cells is FDA approved. They will vet mothers who are planning on having an elective um, C-section. Okay. So they vet these mothers, they're tested for all the, diseases, viruses, non-smoker, non-illicit drug user, and they're followed up to birth. And then once the birth happens, they're taking the placenta and taking stem cells from the placenta. Okay. So these stem cells are highly potent. They are adult stem cells. It has nothing to do with fetal tissue, nothing to do with, the ethical, unethical processes that you may have read about, those sorts of things. This is strictly adult stem cells from a placenta or umbilical cord after a baby is born from a consenting mother that has gone through the vetting process of allowing this lab to use that placenta for stem cells. Okay. So these stem cells are adult stem cells. They're very potent. Again, they just got done helping to make a baby in the placenta, and they haven't been exposed to all the environmental things that we as adults have put ourselves through as we've aged throughout the years. So these are probably the purest, most potent form of umbilical or of stem cells, and that's why I like to use those when we're talking about the treatment options that we presented today. Okay. But so you can get stem cells from these different areas. Okay. So conditions that can be treated, you guys can read all of these. A lot of these are systemic. So rheumatoid arthritis, you have COPD, diabetes. Trying to think of more of the kidneys, degenerative disc disease. Those are all things that a lot of people experience as a systemic type process. So your whole, it's not just one area. Okay, yeah, I hurt in my left arm. Okay, well, that's great. But a lot of these are just systemic autoimmune where your body is fighting itself. So the stem cells, if you are treating, let's say, rheumatoid arthritis, that is a systemic type of condition of arthritis that is fighting your own cartilage and your own tissue throughout every joint in your body. So when we're talking stem cell treatment for somebody like that, instead of just injecting in every single joint that somebody has, you can take stem cells, put them through an IV, like intravenous infusion, and inject stem cells through the infusion that circulates through the bloodstream reaching the cells within the body. So once these cells are in the body, they are hanging out. Your body is amazing in that it signals these new stem cells to become, recognize, and become, new cartilage or tendons or, um, neurons, types of tissues that your body is recognized as being damaged. So it's a process that's an ongoing process. Usually, once you infuse, I mean, I'd say probably within, some people get results within just a few days. They can tell something is transforming. But I would say within at least 2 weeks up to a month to really give those stem cells time to start utilizing and work. And then once you have the stem cells, they don't die and leave and wear off. They're always in your body. Now you can kill stem cells. Heavy drinking. We try to get people not to take a lot of, steroids and things like that that could damage tissue, normal tissue anyways. You're trying to preserve those cells and giving them time to get in and really start doing their thing to help repair whatever your condition may or may not be. Okay. Any questions so far? Good. Okay, so you guys can see on here like sciatica or tendon injuries, disc disease. Those are all areas. If it's one specific area, you can actually take the stem cells. I do them under an ultrasound guided procedure where I will inject the joint, localize my needle, find the damaged area, and inject the stem cells right at those tissues. And that way, you're not wasting stem cells from somebody that doesn't need an IV for stem cells. Does that make sense? If, hey, I just have an injured shoulder, okay, well, let's get stem cells on that injured area and let those stem cells get in the joint. Your body will start signaling and preparing those cells to become new tissue that may be damaged. So your tendons may be damaged, your cartilage, and just start healing, real healing. And that way you're not left with you can use steroids. I don't know if you guys have experienced that or anything, but you can use steroids in joints. Basically, all that is doing is taking out inflammation and putting a Band-Aid on an area that's painful. This is actually repairing, taking out inflammation, but also repairing the damaged tissue so that you're healing. And now you got, whatever your disability was, hey, it's better, it's healed, it's repaired. It's okay. Let's go here. So going back to conditions that can be treated. So if we infuse, so a lot of, I know you guys are, with amputated limbs and things like that. So how this would work in your situation, depending on, where the amputation was. Delsey and I have had this conversation before because it's still in an experimental type phase. There are studies out there, but we infused stem cells with Delsey. Her experience was she reduce her pain greatly, her phantom pain. Okay. Now she's got a bunch of traumatic, injuries alongside just her phantom pain. So we're talking true, cartilage pain in, her shoulders, her other knee, the TBI that we already talked about. So just infusing stem cells on her, she already started to feel a difference. So they'll say, how long after the infusion did your pain, would you say, diminish or?
The phantom pain was gone the next morning within 24 hours. The rotator cuff was a couple weeks, and then everything started to follow. So
Wow.
a month later, I started feeling so much better, clarity, like I could tell my brain was starting to work. But the biggest thing was the phantom limb pain was gone the next morning, and I mean zero.
I feel like, Jeremy, you're going to get 7,000 calls tomorrow in your office.
Well,
It's
again,
amazing.
and that's the thing. And whoever calls me or questions and things like that, I would never guarantee you and say, hey, listen, I promise you I can heal you. That would be the wrong thing to say. That's unethical. I don't want to give people false hope. But it is real. There are studies that support it, and it may not be the exact same story, but most of you, or what I have found, have tried everything under the sun. You're tired. You want that hope, and in desperation, is there something out there? And this is natural. This is something that could potentially help you, or at least minimize in a way to help you function. And that's the biggest thing. So functionality, if you can decrease the pain but have more function, that's living, in my opinion.
Can I
Um,
ask a question about this?
yeah,
I'm a board certified physician associate. I worked in
yeah,
vascular surgery and wound care for more than a decade, and so I'm, very Western and very for the worst. Probably there was a set way that we sort of cared for pain in the work that we did, and it was baseline non-narcotic, or narcotic surgery. And why do you feel like, because my own personal journey, I did stem cells after a shoulder surgery with a really
uh-huh,
innovative orthopod in Dallas, and
yeah.
uh, no one else had offered that. But why do you feel like everybody tends to find these types of really helpful procedures that have much less side effects only at the end of this exhausting journey? Like, why is that, do
Yeah.
we?
I mean, you guys probably do more research than anybody else. I mean, as a provider, I go to conferences and say, hey, what's the latest thing? What's this? And to turn the normal, mainstream, this is how we do things. We've always done it this way. It's hard to move a medical community and different treatments, but I think you'll find more so uh, apothecary, more of these homeopathic type providers are coming out because the treatment supports it. It used to be, well, that's nonsense, that's voodoo, and you got laughed at. But now there is some data to support that that's very important. I think more people are open to it, and I think more people are just educated, and they've seen the side effects, or I've done everything, and I think when you first just go into an office, they tell you, okay, well, I'm going to refer you to so and so. Okay, well, great. I've been doing this for 50 years. I didn't know there was anything new, or why would I change what I'm doing now? So I think just more education on our side, on patient sides, that they are asking for. And if you're not up to speed as a provider, you're going to be behind really quick. So why people, you know, it, there's not as many people doing it. So I think obviously your overall is going to be your normal medicine. We're going to give opioids. We're going to do surgery. We're going to do this, and not that it's not effective, but long term may not be the best thing. So now people are, hey, let's try something different. There's enough data out there that it's safe enough and not harmful. You don't
And
want to do
I
more
think the
harm.
other piece too that you spoke to was patients typically, I know Delcy, you got there and I got there in my journey. You have failed so many things and you have so many adverse outcomes from poor medical treatment in this literal sense and also the medical sense, that you are willing to try anything as odd or as new or as different as it might be, as under supported verbally as it might have been in the circles that you've traveled, because you just need to get out of pain. You just need to feel better. And in that desperation, you're almost like willing to try these things. But I want one message that folks are listening to this today to take away is, don't wait for desperation to educate yourself in both the Western and the sort of naturopathic, holistic care fields. I would recommend now, and I do, to everybody that I meet, once they have a definitive plan by their providers, Western providers, I, as a Western provider, say, I will fund you to go see a naturopath just to get information to round out options, and then let's make some choices, because
Yeah.
it could save a lot of money, could save a lot of hurt, could save a lot of bad outcomes. So I just want to put that out there for folks, that if you're not in a desperate state yet, just get someone else's information like Jeremy.
And Tina, you said though, you said exactly right. It's desperation. When I met Jeremy, I was an opioid addict. And I chose Jeremy because he's a holistic
pain specialist. He doesn't want to prescribe opiates. He doesn't believe in it. He wants to try holistic alternative medicines. And I didn't know anything about stem cell until I met Jeremy. But by the time I got there, I was so desperate. I wanted off those pain meds. I wanted out of pain, and I just wanted help. And unfortunately, you're right. People aren't talking about it enough. And that's why I've invited Jeremy to a lot of our Facebook amputee groups, because I want him to hear the conversations that we have, because there's a lot of things that the stem cells can help, a lot that we deal with on a daily basis, just our world of amputees.
And it also has to do with medical training. I mean, as a
Yes.
physician assistant, I am not a physician and I don't have advanced degrees in pain therapies, but there were no education portions in my didactic or curricular studies about stem cells and the treatment of pain. So how would these providers, if they don't have academia or their apprenticeships teaching them that, how would they be brought up to know this as a primary option? I think that speaks to the differences in training and where folks do their education, which varies person to person, which is why more input, more information from different people is always, I think, the solution. You know, Captain Planet said it best: the solution to pollution is dilution.
Well,
That's
and
scary.
two, you know,
That's scary, Tina.
a, a lot of, like I said, training programs, they're not going to have that. You know, there may be some now that may kind of spill some of that in there as like an adjunct, or most people that I know, it's been after, you know, they've been in training and they're wanting to stay up on the latest and greatest. But it's also hard if I'm a surgeon, and again, I'm not downing surgery at all. Like I said, there are times where you need surgical, you know, intervention. But if I'm trained in that and that's how I make my living, okay, well this meets the criteria for surgery, then we should do surgery. So, you know, not that that's a bad thing, but if there's something in between that could help or put off surgery or help heal, if I'm a surgeon, and there are some, I know some orthopedic guys that will actually do like some platelet-rich plasma PRP and maybe offer stem cells, but it's few and far between. And most of them, like I said, it's just how you're trying, it's how I make my living. I'm a surgeon and I operate. So you have to do the digging and kind of ask around and maybe ask your surgeon, hey, do you know anything about stem cells? And just see what their response is. And maybe
And I
like,
think
yeah, you
that's a
know,
key point, Jeremy, is
yeah,
self-advocacy. I talk about this
yeah,
at the Amputee Coalition Conference. I have presentations on it. You know, everybody just wants to trust providers, and it's not that you have to distrust them, but they only know what they know, and you as a patient
that's
don't
right.
know what you don't know, and that's a very scary mix of knowledge bases. And so people have to take responsibility for the direction of their care. There's third-party advocates people can hire. There's infinite resources on the web. I mean, how great is this generation compared to the one before us? I don't know how my mom was able to keep 3 kids alive without Google, but you know, so people just need to do research and dig in, and so that's why I'm so
Yeah,
glad we're pushing this out.
yeah, yeah, perfect. So, so back as far as stem cell infusions and injections, there really are no side effects. If you're ever prescribed a medication or whatever, there's always going to be some side effects or, you know, other things that come along with that. So when we're talking stem cells, as far as having a reaction, anaphylaxis, things like that, that's not going to happen because what we're dealing with is a blank slated cell that has no, okay, I know you guys may be familiar with, but if you ever received blood transfusions or things like that, you have to test those types of blood to match your blood type or something that you can tolerate as a recipient because there's antibodies, there's things on there that your body will reject and you will be in trouble, right? So when it comes to stem cells, these things don't have those antibodies. These things aren't going to cause a reaction to where you have to match a certain stem cell or things like that. So, you know, having a reaction from it is not even a thing. They do. There's conversations out there on whether you should infuse on somebody with active cancer. I'm in the field of I would not infuse stem cells for somebody with active cancer, as that's really the only thing where I really wouldn't give stem cells to a person. If you're getting infusion of stem cells, um, some of the risks, and Dulcie can speak on this, fatigue is one thing. It may feel anytime you introduce just anything that's not your own, your body is going to look at it, not reject it, but it's taking it on as something new. So your body, as stem cells start working and your body's starting to do its thing, you're utilizing a lot of uh, uh, your cell's ability to maintain your normal uh, cycles and things that you do. So you may feel fatigue. Usually all these things are transient. Um, Dulcie, you remember how long your fatigue was? It a few days or maybe even a week with you? I don't remember.
The fatigue only lasted a couple days. Nausea
Yeah.
lasted about 4 days.
Okay.
But through all of that, I felt like the fountain of youth.
The what?
The fountain of youth.
Yeah, exactly. So
Is-
of the things that could happen, fatigue, headache, mild chills, usually that's like the first stage, just like a little achiness, some nausea. Those are about the only things that you're going to experience, if at all. Like Delsey just said, you are going to feel like youthful again. You're like overwhelmingly like, I don't know what's happening. It'll be like the best shot of espresso you ever had, but
And
you feel youthful.
my skin was so
Yeah.
clear, beautiful. It was awesome.
Yeah, and that's everything. And it's every single cell in the body can be affected. It's not just, well, this is the only cell that we target. So as a whole, your immune system, like she said, your face, your skin, all of those are included in that. So it's just an overall, boost of energy and just a new feeling of youthfulness. So the data is out there to support that. I know people that do stem cells like every 90 days or twice a year just for those reasons alone. Maybe kind of help prevent some potential, um, you know, uh, diseases or viruses or, something that can happen as we age. They do it on a regular basis. It's not harmful. You're not going to hurt yourself. It's just something that they want to do because the technology is out there. So,
So Jeremy,
yeah,
question, you were Tina's surgery. Would an infusion help her heal faster from her surgery?
for any type of surgery, is that what you said?
Yeah, I was curious about hers. Like, what was yours, Tina?
Oh, I had a septoplasty with some reconstruction internally.
I guess in general, does it help you heal faster?
I mean, obviously, it's like we talked earlier. If you're, a young kid, 2 years old, 3 years old, you have one stem cell every 10,000, you're going to heal. Anytime, I don't know if everybody's, when you have surgery, you're just kind of like run down for even minor surgery. Your body's like, what the heck just happened? So beneficial in that, yes, I'm sure speeding along the healing process. Would I go and spend money for stem cells just for hey, I'm having surgery? You got the money, sure. Go ahead and do that. But if anything, it's probably gonna help you just boost your immune system and give you that energy back and recovering that way from like a general anesthetic.
I already did that because I got a babysitter all week, and I feel like that's the primary way that parents can heal better in a week.
That's right. That's right. Let me put this. Okay, so we kind of already talked about this harvesting stem cells. I don't, again, most people don't like being poked or harvesting from stem cells. You can do it, like bone marrow aspirations. Those are all things that can be done. But what we're talking about, the IV infusions, and even inject them in and around neural tissue, joints, I found it much better, more reliable to do the umbilical cord stem cells. They're more potent. They're easy to access. They're actually shipped from a lab. They're frozen when you get to them, but they're measured by the millions. So you'll know exactly how many stem cells you have to inject. And that makes all the guessing work. That makes, well, maybe Jim's stem cells are not as potent as John's stem cells, or maybe you have more stem cells per sample than somebody else. So this kind of takes all that guesswork out of it. Excuse me, and it's just a better, more reliable way, and they're more potent in my opinion. Okay.
I should say before I met Jeremy, I did PRP. I did the where you exasperate the bone marrow from your own
Yeah.
body. I didn't get anything out of it.
Yeah.
And that's when I met
And you
Jeremy.
can
I have tried both.
and you can do that. Like I said, if, hey, I've got a shoulder injury. You can't infuse those. You have to go through a process to really sterilize those. You can inject your own stem cells right from, you harvest them from the bone marrow, inject them into the joint, and there you go. But again, you don't really know how many stem cells do we have. Is, is your stem cells potent enough? Well, if you're 60, 70 years old, you may not be as potent. When you would rather have stem cells from you know, a, a baby that was just made, or a more potent style stem cell. That's what I would want. So
Someone who
we
has
already talked to,
major trauma, 35 surgeries, and
right.
24 blood
You've been through it.
transfusions, and like I didn't want my own, that's for sure.
Exactly. And so we talked before, so I get my stem cells. It's from FDA regulated, with their protocols. Most of my efforts are coming out of Houston. There's a company that vets these. The FDA is regulated, and they will ship them. So if you're wanting stem cells, we would talk on the phone, talk about your condition. If you're locally, do an examination and go through the whole process. And then we order the stem cells. They can ship them overnight because they come on dry ice, so they're frozen. So they ship them overnight. Once you show up for the appointment, they unthaw in about 10 minutes, and you just do all the preparation and inject the cells or infuse the cells. Okay. Um, so how many stem cells do you need? What are we treating? What's the whole thing about that? So a lot of it's based. So in Delsey's situation, we originally gave her 30 million stem cells. We infused them through her circulation or through an IV. Okay. There are some people out there that they want to calculate for every kilogram that you weigh, you need 1 million stem cells. So if you weighed 70 kilograms, you need 70 million stem cells. Some data supports it, some don't. If you're a bigger person, I would probably venture to say, maybe double the stem cells. Delcy is a petite lady, 30, I thought was well enough for her. Again, we're talking about costs too. So, I don't want to tell her, hey, you need, 120 million stem cells if you don't need them, and she can get just as good of a result from a lesser amount and not have to pay as much. So, but there are some, research or studies out there where they will do it per kilogram, 1 million per whatever kilogram you are in weight. Now, if we're talking about injecting just joints, usually I don't like to give less than 10 million stem cells per joint. Um, let's say if you have a hip joint that's a little bit bigger, I would probably do 15 to 20 million stem cells for a hip joint. In the knees, 10 to 15 million is a smaller joint. Same with the shoulder. So it just kind of depends, and that's just a conversation that I would have with you personally, and just kind of go through, what are we trying to treat? What's your situation? Okay. Um, let's see. Okay, so why invest? Like I say, a lot of us have tried everything else. You get tired of the same thing, no results or little results. So, something that we said earlier, it's safe. There's data to support that it actually can heal, can actually make changes and repair damaged tissue. Um, there's really no downside other than, hey, this didn't work as well as I thought that it would, or, I got this much relief, do you want to repeat it? Do you want to, this is the conversations we have afterwards. I want to know, how did you do? Where are we in in the situation, do you want to try more? Are you satisfied? You can always give more stem cells. But again, that's a conversation one-on-one. How do you feel about it? I'm not here to push something on you that it is not working clearly, right? But again, the only downside would be an investment money-wise, and it didn't give me exactly what I was expecting or what I wanted fully. But other than that, side effects, there's really none to speak of. Okay. And as I said before, there's nothing out there that's 100% proven, but again, there's data to support. And I know a lot of people, a lot of providers that I deal with, colleagues of mine that are taking stem cells, patients of theirs that have done stem cells, and all the results are promising and have improved than what they originally started with. Okay. Um, we talked about this, and then I talked about little to no risk contraindications for patients that are actively in cancer. That would be the one thing that I would do stem cells for. Okay, costs. So here we go. Again, there you will find costs all the way across the board. Some people, it's on the lower end. Some people are just astronomical in the pricing. Maybe areas of the country, or you can even get stem cells outside of the United States. But those are all personal choices, and where you want to go for your treatment. But range for anywhere from 3,000 to 25,000, depending on, are we infusing? Are we injecting? Are we doing a combination? How many stem cells do we think we need in that process? Um, Again, these are more, personal things we can discuss on a consultation and kind of figure out, what are you dealing with? What do you want to treat? And then get more of the, the details on what the cost would be for that. But the range is around 3,000 to 25,000, depending on how much we're doing. Yeah, go
Can I
ahead.
ask a question? Yeah, just a question related to that. Is there any insurance coverage at this time, and do you anticipate on the horizon there may be at some point?
So insurance currently does not cover it. Would they ever? Potentially, but again, if anybody knows anything about insurance, it's a fight to get some of the smallest things done, or it takes a long time for them to, get on board to do those things. So, I mean, some part of the, injections insurance would cover, but again, I don't charge for doing the injection because you're already covering the stem cells. That's just
Yeah.
kind of an included cost, or there's no extra things that I would bill insurance for.
And do you have like a deductible upfront for these services, or do you have payment plans, or is it sort of all due at the time? And then also, is there any kind of dosing frequencies that you can speak about that are typical?
So as far as payments and things, I usually will get like a down payment to order the stem cells, because if you order stem cells and then, hey, I don't want to do it or whatever, those stem cells are dead. I mean, you can't reuse them. They do come on dry ice, but their viability shrinks the longer that they're not frozen, right? So what I typically do, just your down payment would be enough to cover just the stem cell cost. And then when you arrive to the appointment, paying again, I mean, I think it's a personal thing if there's a payment plan to work through. But again, I think it depends on the situation. How much are we talking, full price and those sorts of
So
things.
ideally, payment due at time of service in the ideal world.
Yes,
Okay.
yes, typically.
And then the dosing
And
frequency, does someone come in and get one dose, excuse me, and then based on their pathology, I know that you said you wait a period of time. Like, are there an average number of infusions that or like, can you give an estimated quantity or an estimated
yeah,
number of per
yeah.
diagnosis?
So let's say, I will take Delcy if we can, for instance. So 30 million we infused, right? So I told her, let's give it a few months, right? She started seeing effects within days, right? We would have contacts, so we did an IV infusion. We ended up doing injections in her shoulder and her knees, and actually in her neck, right? So as we went along, her shoulder and knee took a little more time. She's like, "Hey, I'm, still got some pain. It's better." And I kept telling her, like, just hang tight. It's still early. Let's give it some time. And then, within a few weeks, she's telling me, hey, my pain has gotten better. So in my view, because the pain had got better, let's just see where we are. And, if the patient, if she's satisfied, hey, my pain is good, then there's no need to say, well, okay, well, we're going to give you another 10 million just because, if it works, the minimal amount is all you need. But I would give it a few months, at least probably 90 days after one infusion or injection to see if you got some result. You should start seeing some changes with them. You can infuse stem cells every 90 days. You can, like I said, some people do it every 6 months. Some people do it just because you're not going to harm yourself by giving more stem cells. But I would at least give it a good 3 months to make sure that you develop some change before I would tell you, hey, let's do more. And then, wait another 3 months. Hey, we, repeated it or whatever. I'm good. Or, hey, can I tweak a little bit more? Or, hey, I got benefits from feeling youthful. Can I just get more stem cells? Sure. We can do all those things. But I would say a good 3 months before I just say, okay, it didn't work.
Okay, another question too. For a lot of patients that are going to be watching this or people, they may be out of state. How do you
Yep.
handle out of state folks? Do you do virtual consultations? Do you prefer them to be in person always? How do you work with out of state folks?
So what I've done in the past, a phone conversation, at least, talk to them personally, trying to see what they're looking for, their goals, get, a history from them, talk about, again, we're not talking about doing, um, like some procedure that we need medical clearance or, those sorts of things. So it's kind of okay, what is your background? What history do you have? Like, okay, well, you have cancer. Okay, we're not going to do that. Or you have diabetes, you have high blood pressure. Okay, those are all noted in the chart. And then if they're coming out of town, I would know ahead of time if I don't want you flying into town and then be like, okay, we're not going to do the procedure. So the telehealth or the phone conversation is enough information, and then we can kind of start talking about how much we need, talk about the cost. And then when you fly in or driving or wherever you're coming from, we would do a face-to-face consultation, just kind of put my eyes on you, maybe do a couple examinations, depending on what, we'll do back and neck. So again, I want to, look at your neck and do some other things before we just, start injecting and those sorts of things. May require an MRI or something prior. But once you flew into town, getting to the office. That's our one-on-one. We've already had our phone conversations. You can contact me anytime in between if there's any other questions that come up. But once we've agreed on what we're doing, we would collect the down payment, fly in, and then you would just, have our conversation, our consultation, and then we'll do the procedure that same day.
Is there any issues with travel home after infusion? Any waiting period, or can they go right home?
No, I would say, overnight. There's some places that they want you there. I want to say there's one place that kept them a week. I don't know why they even do that. But I've had, patients will fly in. I can help, arrange some local hotels in the air, just give out some information. If they feel more comfortable, there's some hotels around the area. Fly in. I've even talked about maybe even doing a service of picking up patients, providing a way. So that is in the works. But I want to
And I'd like to
consider
talk
also,
offline, Jeremy, because I'd like to grow a branch of Less Leg to
yeah,
provide funding assistance
yeah,
for some of these things to make this more
yeah,
available for people.
yeah. Because you can't, some patients you can't just pick up and get in a normal car. You gotta have some considerations for getting around. So if I can make their travel easier, pick them up at the airport, bring them to the hotel, get them from the hotel to the office. That's something I would love to do to, make it just plain and simple. Get here, get the treatment, and get you home.
Now, in Texas, do they get picked up by horses, or do you guys have cars down there?
We have both.
As a
But
I prefer a horse.
as a
real,
representative of Less Leg More Heart, I can be the welcome committee some of the
there
time
we go.
and pick people up from the airport, bring them in.
I did have a quick
Yeah,
question. How long is the actual infusion process?
30 minutes. Like I said,
Okay.
you don't, yeah, basically you can push them like a bolus. I'll give a bag of fluid. So, 5-minute push, but then a bag of fluid. We'll just
Okay.
run in just for hydration.
And I do have one more question. I'm sneaking them in
Yep.
because I know we're tight on time and I really appreciate everyone's commitment to this time domain. But say somebody is having a procedure like an amputation where they're cutting off a considerable amount of long bone,
Yeah.
right? Is there, or have you ever experienced the thought proactively of stem cell harvest in the specimens removed
Yeah.
for infusion? Or how would a patient coordinate that type of care if they're preoperative and perioperative to try to get that infusion shortly after to improve healing?
So you're talking about taking their own stem cells?
Yeah, so the leg that's, you say they're a BK or an
Yeah.
AK, taking the
Yeah.
stem cells from the portions that are
Yeah.
being removed and then using those stem cells in an infusion to promote recovery.
Well, so what would have to happen there? So long, and probably to be honest with you, their long bone where it's being amputated is probably not the healthiest tissue. Just because maybe it's a crush injury or, diabetes or whatever's going on, those sorts of things probably wouldn't be the best specimen. I would feel like I wouldn't be doing the patient a service of saying, hey, let's use your stem cells. I think it's good in theory. I know there's a bunch of like even mothers that are birthing using their own placenta to harvest and keep for their kids. But that whole process of getting approval, a hospital that would actually do it, because it's a harvesting process, and to uh, uh, trying to think of the word, salvage those stem cells, washing them, getting to the process of separating them is a big time deal. That's why
Yeah,
there's
and with the
specialty
lack of
labs that do
with
that.
the lack of collaboration of care that already exists and the hurdles
It would be
patients,
hard.
it doesn't sound like
Yeah,
we're there yet. So
exactly. It's easier just to get some potent stem cells, ship them over, boom, we're done. Yeah.
I have one statement and one last question, and then anyone else that
Okay.
has questions.
Yeah.
I did want to mention one of the first things that you said in the beginning of your speech, and I wanted to highlight this was, I don't always know things. I'm not always going to tell you
Yeah.
things are going to work, but I will tell you I'm not sure. But let me find out and let's try some things together. And that really
Yeah.
stuck out to me because as a clinician and someone that's seen dozens of providers,
Yeah.
the people that I can trust the most are the people that are humble about the deficits in their knowledge and the
Yeah.
deficits of the procedures that are being done. And so I just wanted to highlight that to other people that may not understand the value of a statement like that with respect to trust. I just
Mm.
wanted to say that. But then I also had a question, and you can do this now or toward the end if anyone else has other imminent questions, but of any highlight examples or any standout examples of things that were just really wow moments for you in your practice with the stem cell treatments?
So I actually have a colleague who, I've known about stem cells for a while, but he actually, we knew each other. We actually went to the same program, anesthesia program, lost contact, but he had actually gone into legit renal and liver failure. I had no idea. And this guy was introduced to stem cells. So he has gone through his own treatment. He does stem cells probably every 90 days, but he was given 2 weeks to live. He had gone out to the Philippines. That's where he got his stem cells and kind of started his own treatment. And recently had come back here to the US. I met up with him probably about 6, 7 months ago, and hearing his story just reconfirms in me that it works, and to watch a live human that I worked side by side within the last 6 months, doing treatment, talking about stem cells, doing the stem cell treatments himself and watching his body heal, looking at his lab work that has corrected itself, liver enzymes, renal function it just reiterates to me that this does work. Hard to explain at times. I think it's an exciting time for medicine, if you will, and what's out there. And I think there's so much more to come in the technology and the research. I think we're just on the tip of the iceberg with all of this, and I think months and years to come is going to be very exciting. But that just kind of reiterated to me that this is the right. It feels right. Patients want the best treatment. They want safe treatment, and they want people to be honest with them. And I can be honest because I've seen it happen. I've treated patients and getting feedback that it makes me feel good to offer something that's not anything that I'm doing, but what is working and just be able to use that as a tool. And like I said, just being honest, because like I said earlier, I don't have all the answers, but I can look at the data and trends and see what's happening and working with people that's worked for them as well.
Amazing. Does anybody else have any questions for Jeremy while he's here with us? If so, just go ahead and unmute.
I was just going to say that one of the reasons, I mean, besides our medical community not knowing and not communicating to their patients, Google, you can't create a Google ad for stem cell therapy. It's
Right.
against, so
Wow.
you see a lot of advertisements. We can do Facebook ads and Twitter and LinkedIn, but you cannot do Google.
Wow.
And I was going to ask you if somehow can we get the Amputee Coalition to start talking about it? You know, they have talked about psychedelics and other, non-Western medicine treatment for phantom limb pain. So I'd love to see if they would start promoting it as well.
I'm a speaker at the conference, and I'll shoot some information to you, Jeremy, about submitting information as a presenter in case you're interested. It's in Atlanta this August, but
Oh, wow.
it's a great thing to talk about. And I do one every year. And so if for some reason they're not filling spots, I'll dedicate personally a section so that if you come, you're welcome to speak or we can share your information because this is something that needs
Perfect.
to get out there. If no one else has other questions, I do want to be mindful of time. Anyone that's watching this back, please, if you want more information, feel free to visit Jeremy's business website. You can find that. Again, it's Valor, VALOR, painandwellness.com. You can read all about him and his journey, the services they offer. There's also contact information to get in touch with him. You can reach out to myself for any information. And again, we're going to work in the back end on developing a support program for Less Leg More Heart to help get this to be an approach people can take some advantage of. So I'll be putting some brain energy into that once this nose splint comes off. Jeremy, thank you so much for your time.
Yeah,
Tina, can I jump in real quick? Just real
yeah.
quick. So I'm on the Amputee Coalition Scientific Medical Advisory Committee. So that's one of the reasons why I jumped on this call was to kind of hear a little bit more about this. And so, yeah, so Jeremy, I'll probably reach out to you at some
Of
point.
course.
And Tina, I can loop you in too, so that you can be part of the
Amazing.
conversation too, if you want to.
Sure.
And then we can kind of go from there about, because I'm sure that there's other professionals, healthcare professionals on CIMAC who would love to even hear some of the stuff that you guys are doing as well. So
Love that. Amazing.
Yeah.
I'm so glad that you jumped in.
We'll have a conversation. I know, right? I'm so glad too.
Thank you. Thank you.
All right. And I don't know your first name, Faulkner. Did you have a question? I gave you
Oh,
raise your
yeah.
hand earlier.
Yeah, I just saw that a lot of the conversation was about injury
Yeah.
and repair, but I was wondering just how well your response was for amputation, where, like for myself, I have what seems to be a neuroma, a big swelling
Yeah.
of a bundle of nerves. And,
Yeah.
I'm sitting with a constant 1 to 3 just sensation all the time. And you mentioned the psychedelics. I did interview with the university. I think it was San Diego State, but it might have been UCSD about their psychedelic program. And
Yeah.
what they were looking for in that program was more of an unmanaged pain, something that wasn't responsive to the gabapentin and the other medications. So I
Yeah.
didn't quite qualify for that. But I just wondering what your response was with the amputations.
Yeah. So again, there's different, like there's phantom pain and then there's like actual pain right at the site, correct? That's where are you having your pain right at your stump?
Yeah, for me, that nerve is right below where that stump is. It's right there on the pressure point of the
That's
of
right.
the
Yeah.
prosthetic. So that is a physical pain, but the crushing, the stabbing, the electric shock, all those other
Yeah.
phantom pains are still there too. Right?
Yeah. So you can, and Dustin and I have this conversation, potentially injecting right around the nerve bundle that can help maybe repair some of those nerves that are, just hyperexcited and those things. That would be one approach. I would probably, in your situation, maybe inject a few physically around the nerve bundle, and then potentially infusing, since you're talking phantom pain as well, and see what kind of response you got from those two areas. I would approach it, in two ways. That would be the infusion and injecting around that area, because you actually have a known nerve bundle that you could potentially get to. And that would be under an ultrasound. Yeah.
Yep.
My
And we
other
talk
question,
about,
have you ever heard of TMR, which is the targeted muscle reinnervation surgery?
I
That's
have.
Yeah, so that can sometimes be helpful for those who develop the neuromas as well.
Yeah.
So that's something else that you might possibly look into.
Yeah, absolutely.
I'm sorry, I better write
Absolutely.
that down. Targeted muscle regenerative.
Muscle
Yeah.
reinnervation. Yeah, it's called TMR.
There's not that many doctors around that do TMR. In Dallas alone, I could only find 2.
Yeah,
Huge metroplex.
yeah.
Yeah, he only pointed it out. For me, it's like walking on a funny bone. So
Oh,
Yeah.
that's yeah.
Oh, yeah.
it's when it happens, when it swells, it's like every step is a difficulty. But
Yeah.
I did on the gabapentin quite some time. I was in May of 2022, so I'm only about a year and 7 months into this.
Yeah.
But the weight gain has been constant after the gabapentin,
Yeah.
after the insurance, right? So I
Yeah.
did ask for a different medicine. He prescribed something else, which also had weight gain as a side effect. So I just said, you know what, maybe I'm done with these nerve pain meds.
Yeah.
So I've just gone cold turkey, but now I'm just
Yeah.
dealing with all of the sensations. So
Well, definitely, like I said, if you want to reach out to me, email, phone call, we can go deeper in conversation about it for sure.
And
So,
also feel free to submit your information to the
yeah.
amputee in need form under our contact section on our website. We have a number of clinicians that also can talk to you about
Yeah.
a variation of treatment modalities, pharmacologic recommendations, and just help round out your knowledge base to guide you through this.
okay, I don't know where I actually got this invitation. It dropped into my calendar. I must have signed
Yeah.
up for it, but
Oh yeah, just go to, and that's a great
I'm glad
question.
you're here.
Anyone watching back, lesslegmoreheart.com.
Yeah.
Under the about section, you can find the heart-to-heart registration, and under the contact section, you can select amputee in need and fill out your information, become part of our family, and we can provide unending support, supplies, and services. We talk with you at 1, 3, 6, and 12 months the first year, and every 6 months thereafter, and provide funding for lots of things. Amputee Coalition Conference, we sent 8 people last year. We're going to send at least a dozen this year. And a lot of other big programs in 2024 now, maybe stem cells. So being part of the family is a good thing. But just to honor everyone's time, we'll have to close for today. I'm so grateful that you all came here. We do meet the second Thursday of every month at 6 p.m. And anyone is welcome to come back using the same link and spread the word. I will be posting the people that are coming in about a week to 2 weeks prior. And if you know any health and wellness experts, clinicians in the holistic or the Western medicine spaces, or any amputee related experts or products or services, please feel free to send them to me at tina@lesslegmoreheart.com, because we're stacking our 2024 list. So thank you all again so much for being here this evening. From my heart to yours, I hope you have a beautiful holiday season. And again, Jeremy, thank you so much.
Of course, my pleasure.
Take care,
Thanks,
y'all.
everyone.
All right.
Guys.
All right. Bye-bye.